me saying that I am an epilepsy ambassador. I am also an epilepsy patient.
Due to how I looked myself, even when before I start treatment of in epilepsy clinic, I was thinking that it is only myself who was suffering from this condition.
Epilepsy is just a condition like any other.
There are some which are being managed, but on the other hand, they are also being treated.
Epilepsy is not inherited. Inheritance, if I can say, is just like 5%. Most of it has to do with brain injuries.
How does one get to know that they have epilepsy? What are the symptoms?
There are some which we call the general epileptic or general seizures. They are the ones which are coming up with the different unique things, like you can see somebody just start starting from the other, from one arm to the other. From there he will just fall down, or somebody can just fall down direct to in the floor. And from there you will that's stiffening. The stiffening will just be continuing, but it is not supposed to be up to 5 to 10 minutes. If it is after above that, then somebody should be rushed to the hospital, the nearest one. But if those are the points. Yeah, if you see something happening to somebody like that, the first thing, the first point to which somebody should know that lack of consciousness to be there. Like with epilepsy, somebody has to lose that consciousness, because after that he will just be there, but knowing nothing he or she is doing. That is where that is how the epilepsy starts. But with some sometimes we'll just come some of sort of seconds, just seconds, and somebody just come back to his or her mind, her senses. Because that is why I've tackled that the different types of epilepsy. Yeah, they are coming in different types.
We'll add to that.
Adding to what Mr. Daniel has been saying, there are these people who have these absent seizures, that's what we call them. The one is talking about, you are there, you have gone, you are not there again, but you are just staring at somebody. There are most people who should be alert are the caregivers, teachers, and anyone dealing with such kind of people. Because like a teacher, you are teaching in class, a child is looking at you. Then you ask him a question, he's not answering. If you are not sure what is going on, you think this child is rude. And the next thing you'll do is punishment. But if you watch well, you will understand, because this person, when he comes back to normal, especially this one who is absent-minded, he just pulls up immediately. So you wonder, is this person around? He just looks confused. And then there are these people who fall down immediately. There are others who don't fall down also. You are stiffening where you are, and you go that way, you stay there. After a while, you see somebody losing. When he's coming past the time, he goes down. There's others who just go down immediately, and all the jerkings and whatever they go on there. So the first times when you are having this, those are the symptoms of the first times. When you notice person having such kind of things, first time, second time, third time, it is advisable to seek medical advice. because it might be something starting up in the body. If you ignore, it becomes worse. So I could say it is better to seek attention. First time maybe the second time, but you notice it the third time. Make sure you seek medical attention.
So as for you, the two of you, then at what point did they diagnose? Certainly it is epilepsy.
As for me, as I have been saying, it started when I was in secondary school. When it was diagnosed was after the first time in secondary school, it became worse. What I was doing there, I can't explain that one, I don't know. Because all the time I was finding myself somewhere surrounded by other students and a teacher there also. But now I remember there was a time I was sent home because of the same issue. The head teacher had to call my parents. They were advised, make sure she goes under medication first, then you come report to us what is going on. Because the teacher was asking, why didn't you tell us this child has an issue? My parents were saying we didn't know also. So when we went, it was now after in the midst of the first term. In other words, like January, February, somewhere there. That was when I went to hospital. I attended a hospital somewhere. It was diagnosed. I was given some medication, and I went back to school. So these things happen, and sometimes we will not even understand it. So what I'll continue saying is, it is advisable, seek medical attention and follow the advice of the doctors, because that way you'll be helped. I am not against anyone wanting to go to pray. I also did it for long, and I am still doing it, even for the ones who have it up to now. But it is also advisable to seek medical attention. Continue praying for yourself, and also continue with your medication. Still, everything is okay. Yeah.
Yeah, I think to just wonder on what my feeling colleague is saying.
As you're adding, we want to know how then you got to be diagnosed.
That is where I was now coming. On my side, my diagnosis started. I think it was 7 years after when the condition started. Because before that period of 7 years, I was just going to the witch doctors, some of prayers, but we never went to any of the hospital. So the first time I attended the hospital, it was now 7 years after this. The condition that started. So, and that is where, when I went there, I was taken with my uncle and my brother. And when I went there, is when I came to realize that this thing is also having, so many people are suffering from this thing. And that is when I was being encouraged. And when I started my treatment, that is even why when I started my treatment, I was so much encouraged. Because I came to realize, it is not myself alone. Because what was embarrassing me a lot when I was still at home was I was just seeing myself. It is me. My life has gone. There is nothing I will do as myself has done. I'm the last one in the family. The other family are just going well. My life will just finish like that. But when I came to realize that this thing can be, because when I visited the hospital, I met a lot of people there. I was now asking them, are you also having this problem? They were telling me that is why we are here. Well, now from there, I start getting encouraged. And they out of that encouragement, that is why I started putting a lot of my effort in the treatment and giving a lot of my time to know, to see if there be some improvement on it. So that is how I came to realize that if you put your effort on yourself and you love yourself, even if you are having an condition, even loving yourself alone will help you a lot. Don't just take yourself as you are gone because of the condition. The condition will just be there. Your life will continue, even if it is it has not been controlled. Because with epilepsy, you have to first of all, it has to be controlled. Is when you can do your other activities as usual. Before it has been before controlment, you will just be there. You will continue with the treatment, but after when it has been controlled and you are going well with the treatment, following up very well with the doctor's advisement and also the drugs, you will see yourself coming back to how you were before.
Yeah.
And that is how you are seeing, even you are seeing us here. That is why we are here today, and you are seeing us the way we are.
So how is the treatment for epilepsy?
As before I say about the treatment, let me add to what Dan has been saying. As you continue with your medication, there is something called accepting yourself. And there are these people also around you. Don't expect them to accept you if you can't accept yourself. What do I mean by accepting yourself? You know, when you have some conditions, personally, why do some people get to the extent of getting suicide? And others go there and start blaming others for issues here and there. It is because you have not accepted what is going on. Just to add that, me, when I accepted what is going on in my life, is the time things started changing. So even if you have the treatment without acceptance, but you are not yet there. You are not yet there because this acceptance also comes from your brain, where the problem also is. I said it is a brain condition. So this acceptance has to come there. You accept yourself, you love yourself. When you love yourself, even others talking around you, it will not bother you. Even when you go to seek the advice of the doctor, what it tells you, you'll be able to go with it. But if you have not accepted, it will be hard to deal with it. So start by accepting what is going on. Accept it's just a condition like any other, and move on. Now coming to the medication. Medications are in different forms, and that all has to do with the doctors, because there are different medications, because epilepsy have different types. Types are different. The way you have been saying that these ones who just fall down, there are others who don't fall, they are just seated. Another one loses consciousness immediately, just after a while is back. Those are the absence seizures, and there are many that go on. So to get a good treatment, it is first to be known which type of epilepsy you are having, and also the doctor is the one to know how to treat you. So you can't treat yourself. Don't say that because I'm this way and so is that way, I'll go for the medication he or she has. Things could be different. So me, I can advise, just go to the doctor. They will get the right medication, because there are very many different medications for different types of epilepsy. And all what I know is that it is treatable. Accept your condition and move on. Thank you.
Yes. Even me, if I just I can add on what my fellow colleague has said. I think he has talked very, very well on that point. And where people are still lacking a lot is this counseling on part of the epilepsy, because it has not been captured very well in the government hospitals. So people lack a lot of counseling, and that is the part we need to focus on how we can counsel the people with epilepsy to know, even if they have started the treatment, how they will continue with it. And there are some circumstances you will see some different things coming out, but you have to take it positively the way it is. But if you take it positively the way my colleague has said, first of all, you accept yourself that yes, I have epilepsy. So you can tell you can go and look for work and tell them before I start working, what you should know, that I'm an epileptic patient. And even myself, I did that. There was a company where I went to apply for a job, and everything was okay. I was supposed to be. All my interview has been done, but what brought this everything back, because I tackled my epileptic part.
You told them.
I told them what I am.
And so they
disagreed with me, and that is how I lost that job. So that is why I'm saying that part of this counseling on epilepsy is what people still
do not know.
Public
awareness
about
epilepsy is still not.
No. So I think if it can be done, even into the medias, different departments, for even people there to know that epilepsy can be treated. Because I know very well that we are still having so many who are suffering from epilepsy, but what they don't know, that epilepsy is being treated. And that is why they are still suffering up to date. So they are lucky, they are suffering because the government has not come in fully to do the awareness or to do things on the part of the, because they are, yes, epilepsy is being classified as a disability. Yes, even us, we have taken, we did our assessment, and we were given the card for disability.
So you people are now being considered.
Yes, but
although you are very.
But with the government, just if you went to the disability offices, what they look after is mostly the physical disabilities. If you tell somebody like me, I've gone there twice. But if I'm telling them that I'm also having a disability, they're looking at me and saying and just saying, this man is just playing around with that.
Yeah, but I also would agree with them, because you are not. You people are very normal, normal people.
Yeah.
So, when did you last have any episode of, since you started the treatment?
As for me, it's now, this is the idea, free of any seizures, but still on a medication.
3rd year free.
Yes.
For 3 years you have not
Yes.
had any seizures.
Yes, but still on medication.
Yeah.
Because the advice the doctors give you is don't stop medication until the doctor stops you. Because as you go on with this medicine, sometimes usually they get used to your body, so they can't be just removed suddenly.
Yeah.
They have to be removed step by step, slowly by slowly, until the body gets used. So I'm still on medication. I started on a high note. We are still going slow by slow. So medication is also being minimized slowly.
Okay.
So me, I'm very free, and I thank God for that. I also thank all who accepted me that far, and I'm very happy to tell others that epilepsy can be treated and all can be well. You can also go on with your life very well. Coming back to the caregivers, I like talking about their caregivers.
Yes.
With your kids at home, no need of putting these kids aside as if they don't have a right to play with others. They don't have the right to go with others. Just make their teachers know what is going on, or the people they are with, and make them free. That one, I'll promise you a change if you can see it and follow it well. Me, I know it is there because I have gone through it.
Yeah, I think just on my side, I can say mine was I was now out from the seizures, just 2, 3, 4 years. But sometimes it just at the early of this year, I was having some sort of the family issues, which is brought to me a lot of stress. And after the stress started coming in, is when I realized, and I got some 2, 3 attacks. Because I was so stressed a lot. It was some because of the family issues within my family. So, but I was thinking that, hey, this thing is coming again. So I started seeing myself, but in fact I was talking to my colleague here, telling her on what is happening to me. He was giving me some good ideas. I think she helped me a lot. And when I came back I came back to where I was, I think I get back on how just to be like the way I am now. Now I can say, for 2 to 3, 4 years ago, I was just okay. But this year, early this year, I was having
of that stress situation.
That is why I had some 2 to 3 attacks.
Okay.
But after that, I just go and talk to my clinicians about what is happening to me. We shared with them, and they tell me that if it's a matter of buying these drugs, we can change these drugs to try another one, which will be affordable for you to buy. And that is what they did. But after what they did that, in fact, I just came back to how
to normal.
Yeah.
Okay.
Yeah, because even what even people don't know, that these epileptic drugs, getting them in the government hospitals is not very easy. So they are just being sold in these big chemistries, private hospitals like Nairobi Hospital, Aga Khan, where, but getting them in the public hospitals is not very easy. So you have to struggle for it. You have a lot of you have to get a lot of finance, use a lot of finance, because with the epilepsy drugs, when you start using epilepsy, that is what I want even people to know, that starting the treatment of epilepsy, we don't want anybody to break it on the way. So you have to continue until the time your clinician, the clinician which started it, will tell you that from today, now I will discharge you from this, taking this drugs. Is when you will leave. Before that, we will just continue. That is why even now at this time, as we are talking, according to the financially aspect, the government has affected the kind of the financial part. We are getting a lot of people who are defaulting from the treatment because of lack of drugs. Yeah. Because they can't afford to buy these drugs continuously. Yeah. So that is even on the other side, it is a challenge which we are seeing in our colleagues who are still we are still having them in the epilepsy clinics, but we want just if government can come in, like the way they have come into the HIV drugs and TB, to come and engage into the epilepsy drugs. I think if they can do that, I think many people will come. Because what they lack is that finance. Yeah. So that is why up to date, yes, most people have see, because it has been awareness there's somehow awareness has been done, but they can't do it because they don't know how the procedure. Yeah. Because when they and even if you, I think you come, you find us in Home Alliance, when somebody has been told that there's an epilepsy clinic in Home Alliance, just go there, you will get treatment. But when somebody will come there, they will told the entire hospital will tell them that there's a special clinic which deals with epilepsy, and it is not free. So that is where people are being now discouraged, because lack of finance. Because they will tell you, this is a government hospital. What are you telling them? How are you telling us that in this epilepsy clinic, everything you have to have money. Is when you can be treated. So those are the challenge. Also the challenges people are getting. Because government has not come in fully on the treatment of epilepsy.
I'm going to ask you people to tell us how life with the epilepsy has affected, how it has affected your general life. But before that, if, for example, we were seated with you and like you said, sometimes somebody can just go blank, or sometimes somebody can fall down, how am I supposed to treat the person? Even first maybe give the first aid before I take them to the hospital.
Yes.
Okay. As for the first aid, let us start with the first aid. First of all, as you said, there are different types of epilepsy. They occur differently. So it depends. Mostly, as for these people who are just seated, what you have to do is make sure that you are close to that person. In case it goes down, you help him. But don't disturb him at that time when he's not there. Just leave him alone. But this person now who has fallen and is jerking, that is the person I want to deal with mostly. the person who has fallen with all the jerks, jerking of hands, jerking of legs, and all those characters. The best thing to do, first of all, be calm yourself. You can't help a person if yourself you are not calm. So you have to be calm first of all, so that you can help this person. That panic inside you, let it go away. Just know it's just something just has happened. Next, make sure this person who he or she is has landed is a safe place. Or if there anything that can affect that person there, put that person in a safe place. What do I mean by a safe place? A place where there is nothing that can injure that person. For example, they might fall beneath benches. That is not a good place.